Hello everyone, today we cover a topic is abnormal labor. So, before going that, what is normal labor? Normal labor, a series of events that takes place in the genital tract in order to expel the viable product of conception, that is fetus, into the external world, is known as labor. Okay. So, here fetus, placenta and membranes are expelled during the labor process. Any difficulty in the normal labor, then it is known as the dystocia or abnormal labor. So, due to any mechanical or functional factors, that is known as the abnormal labor or dystocia. So, if you see this abnormal labor, that will go with inadequate uterine contraction, then insufficient cervical dilatation and descent of the head. So, three processes very much essential for a criteria of labor. So, good uterine contraction, cervical dilatation and descent of the head. So, any deviation of these three factors, then labor will go with dystocia or difficulty in labor or abnormal labor. So, first we will see what are the causes of abnormal labor. So, causes in the normal labor essential criteria is there. So, as the reason we will see what are the 5 P's. First one is passenger that is fetus. Fetus related any problem. So, fetus, if you see multiple pregnancy, 2 fetus are there. So, if 2 fetus are there, they can go with malpresentation. So, during the labor time, interlocking of twins babies in the chin to chin region, and they can go with Siamese conjoined twins, difficulty in labor. And if you see normal macrosomia, body weight will be increased. So, that conditions more than 4 kg, 4.500. So, this type of cases they can go with abnormal labor related to fetal causes like ascites, hydrocephalus, congenital anomalies of the fetus also having the problem. So, these are the problems of the fetus. And if the fetus is having like malpresentation, like breech presentation, frank breech presentation, then next brow presentation, persistent brow presentation, face presentation, shoulder presentation, and position of the fetus, that is occipito-posterior position leads to dystocia. Then next one is passage. So, passage. So, first we discussed about passenger, that is the fetus. Next one is passage. Passage means birth canal. Birth canal, if you see pelvic diameters, any decreases in the pelvic diameters like inlet cavity and the outlet, any contracted pelvis, cephalopelvic disproportion of the head and the pelvis, and if there is having any robot pelvis, then as Nagel's pelvis. The normal pelvis, you know, that is a gynaecoid pelvis. Apart from any diseased pelvis, osteomalacia pelvis, any fractured pelvis is there, and any spine abnormalities is there. So, this factors. And next you see soft tissues problem. Soft tissues problem, if you see any myomas is there, any fibroid is there, okay, any congenital anomalies of the uterus or the cervix and the septate vagina. So, these are the major problems that comes under the passage, mainly the bony pelvis and the soft tissues problems. Then next one is power. Power, if you see that is the uterine contractions and the maternal bearing down, that is the pushing actions. So, what are the factors that hinder? If the woman is short stretcher, multiple pregnancy, polyhydramnios, that will go with the laxity of the abdomen, and if the malpresentation problem is there, injurious administration of oxytocin or other drugs, and so these are the major problems that leads to ineffective uterine contractions. So, then next if you see what is the other thing is placenta. So, fourth point is placenta. So, placenta, what is the location of the placenta, whether it is an anterior or a posterior, upper part or lower part. So, placenta previa, one of the complication, vasa previa, going with labor, dystocia, emergency situations, abnormalities of cord insertions is there, Then next if you see morbid adherent placenta is there. When the placenta is separation has to be taken in the third stage of labor. If it is taking in the second stage of labor, early separation, that is antepartum hemorrhage. So this all can go with the postpartum hemorrhage also as a placental causes. Then last one is, fifth point is psychic, emotional status of the women, any anxious of the pregnancy, how they are going with the labor process, that all comes under the emotional status. Then next other causes if you see any medical interventions, if you already repeated vaginal examination is there, amniotic procedure is there, any administrations of drugs are there. Then next one is prolonged labor, if the duration of labor is more than 18 hours. Then next one is prolonged second stage of labor. So second stage of labor, if you see multi-para women 2 hours, primary para mother is 1 hour. So if the duration is more, then also they can go with abnormal labor. And protraction disorder mainly the cervical dilatation. So protraction of active stage, that is if the cervical dilatation is less than 1.2 or 1.5 centimeter within 1 hour duration, then it is known as protraction of active phase. Protraction of descent, that comes under second stage. When the descent of the head is less than 2 centimeter per hour, then it is known as protraction of descent. Then other condition is arrest disorder. Arrest disorder, if you see complete stoppage of cervical dilatation. So that is known as descent of the head. So first we will see arrest cervical dilatation, that is known as complete cervical dilatation will not be takes place. Arrest of descent means there is no descent of the head when we are going with the observation. And secondary arrest disorder, first if you see the cervical dilatation will be nicely happen for the women, as the labor is progressing, uterine contraction will be good, but half a time the cervical dilatation will be stopped. So that is known as the secondary arrest. So these problems we can identify mainly. There will be lack of cervical dilatation, ineffective cervical dilatation, and there will be ineffective descent of the fetal head. So these are the main causes that go with the abnormal labor. So next we will see what are the classification of disorders. One related to pelvic dystocia, second one is soft tissue pelvic dystocia, mainly if you see because of the variation of diameters of the pelvis. Soft tissue dystocia, any soft tissue problems like tumors, myomas, congenital anomalies of the uterus, vagina and the cervix or cervical dystocia. Then next if you see fetal dystocia, fetal causes like we have described so many causes, no? Malpresentation, multiple conjoined ascites, interlocking twins, and so these are the main uterine dystocia also. So these are the main classification of dystocia. So next we will see some of the conditions that comes under the abnormal labor. Well, first we will see what is a contracted pelvis. Contracted pelvis means when anatomically we can define, or when the diameter is less than 0.5 centimeter in the pelvis, then it is known as the contracted pelvis. Then cephalopelvic disproportion, there is a disparity between the head and the pelvic, that is known as cephalopelvic disproportion. Prolonged labor, third one. Prolonged labor means when the duration of first and second stage of labor is more than 18 hours duration, then it is known as the prolonged labor. The next condition is precipitate labor. Precipitate labor means when the labor, all the process of labor, first stage, second stage, third stage will happen, first and second stage will happens within 3 hours duration, then it is known as precipitate labor, very fast labor. If you see cervical dilatation in 1 hour, more than 5 centimeter cervical dilatation will be there in the precipitate labor. Then another one is abnormal uterine action. Abnormal uterine actions, if you see uterine inertia is there, primary inertia, secondary inertia. In uterine inertia, ineffective uterine contractions, infrequent uterine actions, the uterine actions will be very weak will be there. So if you see uterus has to go with adequate contraction, intensity, frequency and durations should be there. So these all will be weak. and primary inertia, this will happen starting period itself, the uterine activity will be weak. Secondary inertia, starting phase the uterine activity will be good. When the progress of labor is there, the uterine activity will be decreased. Then next one is hyperactive lower uterine segment. So, fundal dominance, upper uterine segment activity will be stopped or inactive. The lower uterine segment activity will be increased. So, hyperactive lower uterine segment will be there. Then next colicky uterus, incoordinate uterine action, all over the uterus will go with contractions, that is known as the colicky uterus. Then next another problem is pathological retraction rings. According to the contraction and retraction of the muscle fibers, there will be a groove that is formed between the upper and lower uterine segments. So, this can be felt on the abdomen. Another point is a constriction ring. Constriction ring is because of the constriction of the muscle fibers, the ring will be formed on the upper and lower uterine segment. This cannot be felt on the abdomen. So, this after giving the anesthesia, if you see, the ring can be relieved. So, pathological ring will be more complicated to the mother, and this constriction ring will be more complicating to the fetus. And another point, if you see cervical dystocia. Cervical dystocia, if you see, that is the ineffective cause of cervix to dilate. Ineffective, the failure of the cervix to dilate, because if you see two classification is there, primary cervical dystocia and secondary. Primary cervical dystocia, the cervix cannot be dilated. Secondary cervical dystocia, due to the problem that is of previous any medical interventions, any surgeries, so any myomas or any present in the cervix, because of that reason the cervix cannot be dilated, that is known as the secondary cervical dystocia. And another problem, if you see obstructed labor, the labor is said to be obstructed when there is no proper cervical dilatation and proper descent of the head, but the uterine contraction will be good, but they will go with they cannot go with the vaginal delivery. So, compulsory they have to go with the cesarean section. So, that is known as the obstructed labor. The next one is shoulder dystocia. So, the shoulder will be impacted on the pelvic cavity, the shoulder cannot be delivered. This is one of the emergency situation, that is shoulder dystocia. Other emergency condition like cord prolapse is there, amniotic fluid embolism is there, obstetrical shock is there, and malpresentations are there. So, malpresentations, if you see, that is the breech presentation is there, breech presentation, face presentation, brow presentation is there, shoulder presentation. Malposition, what is meant by malposition? The occiput will lies in the posterior part of the pelvis, that is sacroiliac joint or directly to the sacrum. So, here long rotation has to be there, deep transverse arrest will be there, persistent occipito-posterior position. Normal mechanism, they have to come like a 3/8 of the circle and they have to go with the normal vaginal delivery. So, if deep transverse arrest, persistent occipito-posterior position, very difficult. Sometimes face to pubis delivery can also be happen in occipito-posterior, that is known as the malpositions. So, these are the major conditions that comes under the abnormal labor. So, what are the complications? Complication: maternal dehydration, acidosis, maternal distress will be there, maternal death, uterine rupture, prolonged labor, infections, sepsis, postpartum hemorrhage, retained placenta, so septicemia. So, these are the major problems. The next for the fetus distress, cord prolapse can be there, anoxia, fetal death, birth injuries can be happen for the fetus. So, management, if you see, as a management, antenatal screening has to be there. We have to closely monitor during the labor, partogram has to be maintained, and we have to clearly identify what is the problem of the mother and decide whether forceps delivery or vacuum delivery or cesarean section. If only favorable condition is there, we can go with the vaginal delivery, otherwise we can plan for the cesarean section. As a nursing point, prevention and early detection, antenatal screening, prompt monitoring, early complicating factors has to be identified, see the risk factors and prevent the complications for the women, and active management of labor continuous monitoring of the partograph, observation of the mother, uterine activity, cervical dilatation, descent of the head, and there should not be any mismanagement of labor like injurious administration of oxytocin or prior delivery of the fetus, fast delivery of the fetus or placenta should be avoided, and these are the major nursing measures we can take in order to prevent the maternal death and the fetal death because of abnormal labor. So, this is all for the today class. We have discussed about abnormal labor, what are the causes, what is the classification, and what are the disease condition, complications, and management and preventions. I am Mrs. Nima signing off till we meet for the next class.